Did you know that over 6 million Americans are living with heart failure today? Despite the name, heart failure doesn't mean your heart stops working completely. Instead, it's a condition where the heart can't pump blood as well as it should, leading to a range of symptoms that can significantly impact a person's quality of life. Welcome to Orange Zebra, where today we dive deep into heart failure, its types, causes, symptoms, and the latest treatments. Let's get started. Heart failure is a chronic condition where the heart is unable to pump enough blood to meet the body's needs. This can happen either because the heart's ability to contract is compromised or because it has become too stiff to fill properly with blood. Let's break this down further into different classifications. Heart failure is broadly categorized into several types, each with its own underlying mechanisms. Starting with systolic heart failure. This occurs when the heart muscle loses its ability to contract efficiently. The heart becomes weaker and cannot push blood out as forcefully, leading to a reduced ejection fraction, aka the percentage of blood that leaves the heart with each contraction. The second classification is diastolic heart failure. In this form, the heart muscle becomes stiff, making it difficult for the left ventricle to fill with blood. This increased pressure can lead to pulmonary congestion and symptoms similar to those seen in systolic heart failure. They can be also classified as acute heart failure. This is a sudden onset of symptoms, often leading to acute pulmonary edema and decreased cardiac output. It's a medical emergency requiring immediate intervention. And finally, chronic heart failure. Chronic heart failure develops over time from medical conditions such as diabetes, valvular heart disease, long-term hypertension, or coronary artery disease. Here, the body tries to compensate for the failing heart over time, but this can lead to complications such as dysrhythmias, ischemia, and even sudden cardiac events. Let's take a minute to talk about the compensatory mechanism the body does in cases of heart failure. During the first stages of chronic heart failure, the body has a remarkable ability to compensate. The mechanism could be so sufficient that many people don't feel any symptoms in earlier stages. It's only when the body's not able to compensate enough that symptoms start appearing. Compensation may help your body adjust to the effects of heart failure in the short term. But over time, it can make heart failure worse by further enlarging the heart and reducing how well the heart can pump. Let's break down how these compensatory mechanisms work, and why they can become problematic. Feel free to pause the video to take notes and like and subscribe. Compensation in the body occurs when the body's not getting enough oxygenated blood. The body thinks that it's hypovolemic, so it works on increasing the blood pressure by increasing heart rate, retaining fluids and sodium by the activation of sympathetic nervous system and RAS system. While these actions temporarily boost circulation, they also increase the heart's workload. Over time, the increased heart rate and vasoconstriction can lead to further weakening of the heart muscle, and fluid retention can lead to edema, fluid buildup, and pulmonary congestion. Compensation in the heart is done to maintain normal cardiac output. The heart wants to pump more blood, so an expansion happens in the ventricle to let it fill, and the muscle thickens so the heart could pump with more force. In the long run, it will lead to a weakened and stiff myocardium. As the heart becomes overloaded, it releases natriuretic peptides, such as brain natriuretic peptide, or BNP, to counteract some of the effects of the RAS by promoting vasodilation and the excretion of sodium and water by the kidneys. BNP levels greater than 100 picogram per ml is abnormal. The higher the number, the more likely heart failure is present and the more severe it is. So what conditions can lead to heart failure? The main causes of heart failure include coronary artery disease, hypertension, and valvular heart disease. Other systemic causes can exacerbate the condition, such as obesity, kidney disease, and diabetes. Additionally, lifestyle factors, such as smoking, alcohol consumption, and lack of physical activity, play a significant role in increasing one's risk of developing heart failure. Family history also cannot be ignored. Genetic predispositions can heighten the risk, making prevention and early detection all the more important. What symptoms can be seen and reported in cases of heart failure? The symptoms of heart failure can be divided into those associated with left-sided heart failure and right-sided heart failure. In left-sided heart failure, the left ventricle of the heart no longer pumps enough blood around the body. As a result, Blood builds up in the blood vessels that carry blood away from the lungs. Left-sided symptoms include shortness of breath, dyspnea, tachypnea, and cough are common. In right-sided heart failure, the right ventricle is too weak to pump enough blood to the lungs. As a result, blood builds up and increases pressure in the veins and vessels that carry blood from the body back to the heart, causing the hallmarks of right-sided heart failure, which are distension of jugular vein, edema in the body, and weight gain. General symptoms that can arise from both types of heart failure include angina, cardiomegaly, and irregular heartbeats. Signs like a ventricular gallop and pulsus alternans are also indicative of heart failure. Moving on to diagnosing heart failure. Diagnosing heart failure involves a thorough examination and a variety of tests. First, inspecting the patient for signs of cyanosis, jugular distension, and edema. Then we auscultate and palpate. The presence of a gallop rhythm or peripheral edema points to heart failure. Many diagnostic tests can be done to confirm diagnosis. Always start with ECG for electrical activity and chest X-ray for heart enlargement. Extremely important to do an echocardiogram to assess the ejection fraction. An EF below 40% is a positive for heart failure. As mentioned before, a blood examination is done to measure pro-BNP levels, which are a key indicator, with levels above 900 picograms per ml indicating severe heart failure. In more complex cases, cardiac catheterization may be needed to provide a detailed look at the heart's function. As we know now, heart failure can progress over time. It is important to remember that many people with heart failure lead full, enjoyable lives. Also, not all heart failure is the same. The New York Heart Association functional class helps us in classifying congestive heart failure patients based on their symptoms and in choosing the appropriate treatment accordingly. Let's go through each stage. Class 1 is for patients with no limitations in physical activity despite the presence of heart disease. Treatment focuses on lifestyle changes and managing risk factors. Class 2 is for patients with slight limitations during ordinary activity. Medications like diuretics, ACE inhibitors, and beta blockers are recommended, along with emphases on lifestyle changes. Class 3 is for patients with marked limitations even with minimal activity. Along with the previous treatments, digoxin and calcium channel blockers may be prescribed. And finally, Class 4 is the most severe because symptoms are present even at rest. Patients may require advanced interventions such as continuous inotropic therapy, heart transplants, or palliative care. Following recommended lifestyle changes like healthier eating, regular exercise, and better habits can ease heart failure symptoms, slow the disease's progression, and improve daily life. While these changes can be challenging, incorporating them into patients' routine can make a big difference. Many people with mild to moderate heart failure can live almost normal lives as a result. Management often begins with lifestyle modifications, reducing sodium intake, quitting smoking, and limiting alcohol consumption. Medications which are used like digoxin to improve heart function by increasing the heart's ability to contract, diuretics to help the body get rid of excess fluids, while calcium channel blockers and other antihypertensive medications are used primarily for heart failure related to hypertension. In severe cases, advanced procedures like intra-aortic balloon pumps is done to improve ejection fraction. Implantable cardioverter defibrillators can be life-saving for patients who have a history of dangerous, abnormal rhythm or at risk to experiencing one. And finally, a heart transplant may be the final option for end-stage heart failure. Alongside these, supportive treatments like oxygen therapy and thrombosis prophylaxis play a crucial role in patient care. In conclusion, heart failure is a complex condition with many facets, from its various forms to the tailored treatments based on individual severity. Early detection and management are key to improving outcomes and enhancing the quality of life for those affected. If you found this video helpful, don't forget to like, share, and subscribe to RN Zebra. And as always, stay informed and take care of your heart.